First, let me just thank Avidro for the invitation for me to present these results of ours. These are my, sorry. This is my financial disclosure. We have heard about collagen cross-linking. I mean, the history of collagen cross-linking has spanned quite long. I think the two professors on the panel will explain to you all later on. So I explained to my patient that this is an application of an old technology for new application. So it is not exactly 100% new. It has been used for many, many years and has been proven to be safe for collagen cross-linking. Yeah. I think PiXL, Matthias has gone through what is the meaning of PiXL is photorefractive intrastromal collagen cross-linking, and by applying collagen cross-linking differentially, be either in the center or in the annular fashion, you actually changes the refractive error. So this is how it is done, just to show that. What he have gone through just now, Matthias has gone through step by step. I will just show you this particular video that is produced by Avidro. So this is epithelium on now for all our cases. After the soak itself, we will just shine the UV light, and it depends on whether we are treating myopia or hyperopia. So if it's myopia, it is a central shine. If it is hyperopia, it's annular shine. The collagen cross-linking effect is actually almost immediate. Most of my patients, once you have done the collagen cross-linking, you can check the refractive error, or you can actually check them straight away. You know, they will tell you there's a change. Okay. I shall just present our very early results on hyperopia. Over here, we have 6 patients. This particular protocol had IRB approval, and we aim to do actually up to 30 patients, which is 60 eyes. For 3 different categories for hyperopia, which I mentioned just now. One group which is without any prior surgical procedure done. One group is post-LASIK. The other group is pseudophobia, post-cataract surgery. So here I'm presenting 6 patients, 4 males and 2 females, 12 hyperopic eyes, mean age 53 years old. So they are all in the hyperopic, presbyopic age group as well. So mean hyperopia is plus 1.13, range from plano all the way to plus 1.5. Because we are treating presbyopia, that's why there's a plano there. Mean reading at required for patients was plus 1.75 for them for the normal use. Treatment plan, epithelial on with supplementary oxygen, and the procedure has been discussed just now. This is how we do it. This is a video to show how we tape up this goggle that's over, because we're providing oxygen. Yeah. So the paracel is given 1 minute for first 4 minutes, then subsequently followed by Vibrex Extra, another 6 minutes. And the oxygen is provided in the last 2 minutes before, at 8 minutes, as well as on during the shine of 10 minutes. This is the PiXL procedure. This is the annular shine. You can see the light just now. This is annular. Okay. Our results, we managed to achieve the mean refractive spherical equivalent changes from 1.13 diopter to 0.31. In fact, this is the changes at 1 month level. And most patients, the other graph over here shows the manifest refraction of the patients. The gray box over here represents they are in plus 1.25 to plus 2. In fact, majority of them actually have a good reduction. This is the unaided visual acuity for FAR. Patients also have improved in terms of pre-treatment of 0.17 all the way to 0.03. With mean unaided near vision improvement of N24 all the way to N6. This is at 1 month level. In fact, first post-op day, you can see the difference already. Usually patients start to improve immediately after the procedure. Yeah. The mean unaided near vision for corrections is actually improved from N24 all the way to N5 at 1 month level. As again, I mentioned before, first day post-op, patients able to see N6. Yeah. So this is also supported by the mean K reading change, showing the steepening of the K from pre-PiXL 43 to 44.5. Likewise, we have shown safety in terms of mean epithelial cell count is unchanged before and after. There's no loss in best corrected visual acuity. 100% still achieve 6/6 vision. However, there is transient epithelopathy, a stinging sensation in the first week. I tell all my patients it's almost like an arc eye, especially for similar to those welder who have arc eye symptoms. No cases of infection. As I mentioned just now in our discussion, we should actually position PiXL as a visual refinement for patients who are emmetropic with presbyopia, the low hyperopes with or without presbyopia, the low myopes, which is not high enough to consider for corneal refractive surgery, as well as patients which had residual post-refractive or cataract surgery refractive error. Of course, for those who are always afraid of any surgery. My conclusion is that treatment for presbyopia as well as hyperopia is still in development. Longer-term data is needed. However, from this particular very short presentation, I will tell you that the mean hyperopia reduction of 0.82 diopters can be achieved at 1 month. Unaided visual acuity is 6.6 and N5 by week 1, and most of them maintained it at month 1. The mosaic system has a unique role in terms of this visual refinement, and it is complementary to our existing refractive surgical options as well. The procedures now currently involve optometrists as well as optometric technician for greater efficiency because the time to treat is actually quite long. Treatment algorithm should increase in range as well as include astigmatic correction. These are the things that we're looking forward for future development. Thank you.